closing my camera. Okay. I don't know where the participants are.
Oh. Am I good to begin?
Yeah, let's just start.
Hi, welcome to FIPCO's virtual community health fair. I hope you are enjoying the session so far. Just wanting to let you know that this recording, as well as all other recordings, will be available starting tomorrow on the event website. You can click on the session you are interested to view, and the recording will be available there. We'd also really appreciate your feedback. So if you can look out for an email that will be sent later this afternoon and provide your feedback, we would really appreciate it. Now I'd like to introduce Maisha Andrews, who will be presenting on cancer screenings.
Hello, everyone. My name is Maisha Andrews. I am the Clinical Administrative Director at Banner MD Anderson here in Phoenix, Arizona. My training is in nursing, so I'm a nurse by trade. And today I want to share a little bit of information on cancer screenings. So let me share my screen so you can see my PowerPoint. One second. Sorry, one second, we're getting there. Can you see my screen?
Not yet.
Okay. Second, let's try it again. Can you see it now?
Not yet.
Okay. Um,
Hit the share screen icon
I
at the
hit
bottom.
that, and it's not allowing me to share. I don't know if it is not working.
Okay. 5, 4, 3, 2, 1.
All right, so my name is Maisha Andrews. I am the Clinical Administrative Director at Banner MD Anderson Cancer Center here in Phoenix. And I would like to present on a topic that is very prevalent here in Arizona as well as the United States, and that's cancer. And so I'm presenting on cancer screenings and stopping cancer before it starts. So February is Cancer Prevention Month. And so as we wrap up the month of February of Black History Month and Cancer Prevention Month, I just want to point out that prevention is key. And so I think that this topic will hit most of you and make a big impact on the way that you behave in your future days to come. So I'll first start out with facts about Cancer Center in the United States. So approximately 39.5% of men and women will be diagnosed with cancer in their lifetime. And that is a pretty high number. That is about almost half of us will be diagnosed with cancer in our lifetime. And so that's why it's so important for us to understand and know the certain preventative measures that we can take. So that way we're a part of the opposite 60%. So there is prevalence in men and women, of course, but the first most common cancer in men is prostate cancer, followed by lung and colorectal. And in women, the most common cancer is breast cancer, followed by lung and colorectal. I do want to point out that colorectal cancer has disproportionately started to affect the African American community. So I will start with a focus on colorectal cancer and how that affects the brown and Black community. So colorectal in the Black and brown communities, like I said, disproportionately affects us. It is the third most common cancer in the United States, and the majority occur in the older population. However, prevalence in younger adults is becoming a little bit more popular. I know a lot of us were really shocked when we heard the passing of Chadwick Boseman, who is a younger gentleman and seemed overall pretty healthy. So we really want to spread knowledge amongst the African American communities about colorectal cancer. So 70% of cancers that are colorectal develop in the first portion of your large intestine, and the other 30% develop in the rectum. So we really want to focus on the preventative measures that I'll talk about later, but I did want to share that 20% of us are more likely to get a diagnosis of colorectal cancer if we're Black and brown over other races. And we are 40% more likely to die from colorectal cancer, unfortunately. So it is very important that we take notice of some of these preventative measures and screenings. So that way, if we do, contract cancer, we can catch it early and treat it. So that way we don't fall in that 40% of more likely to die. So colorectal cancer has some risk factors that are preventable and then others that we may not have control over. So the absolute risk factors, such as a personal or family history of colon or rectal cancer, or your age, like I said, older populations do tend to contract colorectal cancer more than the younger generations. And also any hereditary mutations that you may acquire from your parents or grandparents are also some of the risk factors that we may have. Some modifiable risk factors are cigarette smoking and tobacco use. So we always want to encourage our population to stop smoking, as well as alcohol consumption, a diet that's high in fat, specifically in animal fats, and controlling our weight. Those are some of the things that we can control that will prevent us from getting this horrendous disease. So next are some of the signs and symptoms, and some of these we may experience, short term, but it's more of a long-term thing that we're looking for. So some of the signs and symptoms of colorectal cancer include rectal bleeding. Maybe you notice there's some blood in your stool or blood in the toilet after you have a bowel movement, or you suffer from diarrhea or constipation that lasts for more than a few days. So like I said, some of these things may occur like one time, and it's just a one-time event, but if they continue to occur, you do want to seek healthcare options to get that checked. Also, a change in size or shape of your stool, as well as abdominal pain or cramping in your lower abdomen. So if these things sustain after, a few days, definitely seek some healthcare advice. Other symptoms include feeling of discomfort or pressure, feeling like you have the urge to go have a bowel movement, but really there's nothing to pass. Also weakness or fatigue, and some unexplained weight loss. So like I said, sometimes, we may be fatigued because we're tired for the day, but if you have prolonged fatigue or weakness or feeling of discomfort, those are the things that we need to look at to explain to our physician. Next slide. Colorectal prevention is very important, and some of these things, like I said, we can take matters into our own hands and choose healthy options. So the first thing I want to discuss is eating at least 4 to 5 servings of fresh fruits and vegetables. And I think the reason why Black and brown communities suffer a little bit more from colorectal cancer is simply because there's the racial disparity that we don't have the same access to fresh fruits and vegetables, and our socioeconomic status kind of puts us in a predicament where we don't have the direct access to some of these things. So if you have the option to get fresh fruits and vegetables, that would be preferred. If that's not an option, frozen would be the next choice, and last would be some of the canned fruits and vegetables. Also, limiting fat consumption to less than 30% of your caloric intake daily is a huge, huge way that we can control our risk of getting colorectal cancer, especially the animal fats that are in red meats and things like that. We really want to limit those. Exercising regularly will also prevent us. So about 30 to 45 minutes of moderate exercise every day will definitely help. Like I said previously, quitting the smoking of tobacco and limiting alcohol consumption, and then that screening of getting a colonoscopy at the recommended age. And since we have seen a higher prevalence of colorectal cancer in African-American communities in the younger population, the new age recommendation is 45. It was previously 50, but now they've bumped that down to 45. So at the age of 45, we do recommend that you start getting those colorectal screenings, which is a colonoscopy. And I know a lot of us may feel like the prep or the actual procedure itself may be daunting, but it's very, very important to get that screening early, so that way we can catch it at an early stage, which would prevent us from having it at a later stage. And the later stage is what puts us at higher risk for death, of course. All right, so that wraps up on the colorectal cancer. So now I want to dive into the prevention tips for all types of cancer. And I'm going to, just touch on the top 6 tips that we can recommend. But of course, there's all different kinds of ways that we can prevent cancer. But these are the top 6 that I think focus on the most prevalent cancers that we face today. So tip 1 would be to increase your activity. So overall, exercise is a really good way to decrease your chance of getting colorectal cancer. Engaging in about 150 to 300 minutes of moderate intensity exercise, and that equates to about 45 minutes a day of a jog or a run, or going to the gym and taking an exercise class, or 75 to 150 minutes of vigorous activity every week. So if you do something that's a little bit more intense, like really heavy weightlifting or things like that, then it decreases the amount of time that you really need, or a combination of both. but overall just limiting our sedentary behavior. And sedentary behavior are things such as laying on the couch, sitting for prolonged periods of time, watching TV. We want to limit that time. And I know that with COVID-19, a lot of us are now working from home. And so we're sitting in a chair and a desk all day and don't have that ability to get up and walk around as much as we used to. So making sure that we go out and get that time either on a break or after you get off work, just to make sure that you are getting that heart pumping, which will prevent you from contacting some of these diseases. And then also maintaining a normal BMI. BMI stands for body mass index. And that is the way that we measure who's underweight, normal weight, overweight, and obesity. It takes into account your gender, so if you're male or female, and also your height. And so based on that, I have a link here embedded in the PowerPoint that gives you over to a calculator where you can enter your weight, your height, and your gender, and it will populate your BMI. And so based on that number, you fall into a category here in this box. And so we want to be in that 18.5 to 24.9, which is considered normal BMI, and that will decrease your chance of getting cancer. So why should you increase your activity? It's a primary prevention, and primary prevention is something that we can do before we have illness or disease. It's something like exercise or eating right, those types of things that we can do to prevent it before it even starts. So here I have a fact of at least 18% of all cancers and about 16% of cancer deaths in the US are related to excess body weight and physical inactivity. And physical activity can help you keep your body weight down and keep that BMI in the normal range. So a lot of these cancers can be prevented by the American Cancer Society's recommendation on nutrition and physical activity. And we'll go into nutrition later as well. So tip number 2 would be to limit our alcohol consumption. And as far as, drinking socially, if you choose to drink socially, we want you to limit your alcohol consumption for women to 1 glass a day, and for men 1 to 2 glasses or less per day to prevent the cancer diagnosis. And we also want you to understand that alcohol-related cancers such as liver cancer is what most people associate it with, but alcohol also causes other cancers as well, and they're listed here on the slide. So it can cause breast cancer, colon cancer, liver cancer, esophageal, also oral cancers. So it's really one of the most important preventable risk factors that we can take, along with, avoiding tobacco and avoiding being overweight to prevent cancer. So alcohol related cancers account for about 6% of all cancers and about 4% of all cancer related deaths. And I think that when we discuss the topic of cancer, we don't really think about alcohol consumption, but it does put us at higher risk. So I really wanted to touch on that. The next one is tobacco use. So we really want to decrease or avoid the use of tobacco. Tobacco contains a chemical called carcinogens, and carcinogens are chemicals that cause cancer. And when we think of tobacco use, we typically think of lung cancer that's associated with tobacco use. But as you see on the diagram here, tobacco affects multiple different areas of our body, including the uterus, the bladder, the kidneys, our larynx, our mouth and throat, as well as our lungs and pancreas and things like that. So we really want to avoid those carcinogens, because carcinogens damage your body's DNA. And your DNA is your body's ability to create new cells. So we really want to avoid having that damaged DNA, because the damaged DNA makes cells grow differently, and these cells can usually turn into cancer. So we really want to keep our DNA in its normal state, because when you alter your DNA, that's when it leads you down the path of your cells growing differently and ultimately leading to causing cancer. So tip 4 I want to touch on is maintaining a healthy diet. So this is one of those primary prevention ways that we can go ahead and alter our lifestyle in order to prevent cancer. So I have this little Wordle on the side that has things that are high risk of causing cancer, and then also ways that we can mitigate cancer by introducing healthy items into our diet. So having a consumption of whole grains, fresh fruits and vegetables, like I mentioned, beans, lean meats such as fish and chicken breasts and things like that. Those are the ways that we can decrease our risk of cancer. But then also an unhealthy way that we can maybe, lead us towards a cancer diagnosis is a diet that's high in fats. I had mentioned with colorectal cancer that animal fats put us at higher risk. So we really need to avoid red meats, those processed meats like hot dogs, things like that. And then also refined sugars. So cakes, cupcakes, those boxed cookies and packaged cookies that we see on the shelves, we really want to limit those and keep those to a minimum. So scientists are still studying the many food and dietary components that are associated with either increasing or reducing one's risk. But we do know that a diet that's high in whole grains, lean meats, and fresh fruits and vegetables will put us at lower risk for developing cancer. So tip 5 is protecting your skin. So skin cancer is actually the most common cancer across genders, and about 1 of 3 people will get skin cancer in their lifetime. And living here in the Valley of the Sun in Arizona, we do have high exposure to sun, especially during our summer months, of course. So we really want to avoid being in direct sunlight, especially between 10 a.m. and 4 p.m. when sunlight is the strongest. So if we do need to go out in the sun, we want to definitely always use sunscreen with SPF in it that's 30 or higher to avoid those UV rays, and reapply it every 2 hours. Even if it's cloudy outside, the sun is still beaming behind those clouds. So we really want to protect ourselves from the sun. Protect those kids from the sun, make sure they're reapplying their sunscreen and wearing protective clothing, sunglasses, sun hats, long sleeves. If you work in the sun, you really want to protect your skin here in Arizona. Also avoiding the use of tanning beds, and then really doing skin checks. So skin screenings are easy ways that we can just look at our skin and evaluate skin tags or moles, things that you notice pop up. You really want to monitor that on your skin. So that way, if anything changes, we want to look at the size. If the size of the skin tag or mole changes, if the color changes, if the shape of it changes, those are reasons where you may want to go and seek out your healthcare provider about those changes. And honestly, it's always a good idea to have your healthcare provider at your annual screening, examine your skin. So sometimes we go to the doctor for specific reasons, but when you go for that annual checkup, don't hesitate to ask your physician to kind of look over your skin to see if there's anything abnormal that they see, because skin cancer is so prominent and prevalent, especially in Arizona. So really, really advocate for yourselves, go to the doctor, get those skin checks. And when you're in the shower or, when you're sitting around, just kind of look at your skin and notice any of those subtle changes, because they could lead to possible cancer if you see any of those changes that I mentioned. So tip 6 is screening and vaccinating. So screening is a secondary prevention measure. And we really want to push screenings because they are becoming more popular amongst our community. So that way we can prevent those later stages of cancer. So I listed some of the screenings here at the bottom, such as mammograms for women starting at the age of 50 annually to prevent breast cancer, pap smears to start at age 21 for females to prevent cervical and endometrial cancer. Also, when I mentioned the colorectal cancer, we recommend that colonoscopies are now recommended to start at the age of 45 for both men and women. And they do have lung screening that starts at the age of 55 if you have a history of smoking. And that test is becoming a little bit more popular, but it is essentially a CT scan, or it's like an X-ray of your lungs, where they can look at that and understand what is going on with your lungs to see if it's high risk. Also, screenings as far as knowing your family history. So when you know your family history, your mom may have a history of breast cancer, or someone in your family may have a history of colorectal cancer. And so knowing that history, you want to communicate that with your healthcare provider, and also know that for yourself. So that way, when you get these screenings, you can be more aware that you may be a little bit more at higher risk. Also, vaccinations. If you choose to vaccinate, there is the human papillomavirus that can cause cancer of the cervix, the vagina, the vulva, the penis, the anus. And there's an HPV vaccine for this that's recommended for our youth between the ages of 9 and 12, so our early teens, and can also be given up to the age of 26. But it's just not recommended after the age of 26. And as you get older, from that preteen years of 9 to 12, the effectiveness decreases a little bit. So that's why they don't recommend it after the age of 26.
Maisha, I'm going to interject. I'm sorry. Just if anyone has any questions, we have about 3 minutes until the question and answer session, but we do have until 12:15 for the rest of your presentation. Does anyone have questions? Okay, I don't see any on the chat screen, so please continue.
Okay, perfect. The hepatitis B vaccine is a way that we can prevent liver cancer, because hepatitis B is linked to liver cancer. So if you choose to be vaccinated, there are some ways that we can prevent some of these cancers. But if you are still kind of on the fence about vaccinations, there are a bunch of resources that you can go to. I've embedded them in the PowerPoint as well, so that way you can increase your knowledge on some of these vaccines.
Okay, Maisha, we do have one question.
Okay.
I was told that my vitamin D is low because of wearing sunscreen all the time. Is this true? And does sunscreen prohibit vitamin D production?
So, good question. Thank you. A lot of us are naturally just low in vitamin D because our body doesn't absorb it as well, especially if we're Black and brown, because we have melanated skin. So wearing sunscreen, I would recommend that you continue to do so. There are different supplements that you can talk to your physician about regarding vitamin D, but I would not recommend that you stop wearing vitamin D to increase your actual vitamin D levels. So continue to wear the sunscreen.
Excellent. Thank you.
Then you're welcome. And then in summary, like I said, we want to exercise daily, avoid consumption of 1 to 2 alcohol beverages daily, avoid tobacco use, eat a very well balanced and healthy diet, staying away from those refined sugars and processed meats. We want to use sunscreen and other sun protective gear, and complete screenings as recommended by your physician or your age group. And if you're willing, again, like I said, vaccinate or educate yourself with really good resources on vaccines that are available to prevent cancer. And here is my list of resources. Are there any other questions?
I think we don't have any questions. Thank you so much, Maisha. This was very informative. For our viewers, we will have this presentation recorded and available tomorrow. If you visit the event site at easthillstream.com/FIBCO, you can hit the link to the session that you would like to view, and the recording will be there. We will also be emailing a survey, so if you could please take a moment to fill out, we really appreciate your feedback. And thank you again, Maisha. We appreciate your time.
You bet. Thank you, guys. Have a good day.
You too.